Last Friday evening, after a conference call with officials from the Centers for Disease Control, the agency did activate its Emergency Operations Center at a Level 2 status. Basically what that means is that key agency staff were working throughout the weekend with federal, state, and local partners in monitoring this outbreak and sharing information. Yesterday, as I'm sure all of you have heard, the U.S. Department of Health and Human Services did declare a public health emergency in the United States as a result of this outbreak. Among other things, what this allows the federal government to do is to begin mobilizing resources to help states better prepare and respond to the outbreak.
But within the state health department stockpile, we have a total of approximately 65,000 courses of antiviral drugs. And then also, as Scott mentioned, we are poised to receive very shortly 25% of our allocation of antiviral drugs and respirators and surgical masks and other material from the Strategic National Stockpile. And it is scary. You hear about, this brand new virus, swine flu, came from an animal and now it's causing problems in people. It's difficult to sort out right now. We're comforted by what we are hearing about from the surveillance activities in the United States, but we are concerned and waiting for more information about what the situation is in Mexico.
Do you think there was a different type of strain, or why are we seeing such a difference in terms of what happens here versus what's happening there?
The CDC has told us that the isolations of the swine influenza H1N1 virus in Mexican patients is identical to that being isolated from American patients. So there's not any evidence of a different strain of virus, that it is all one and the same.
Did you have any idea as to why the cases seem to be more severe there versus what's happening here?
No, I'm sure that the public health infrastructure in Mexico is different than it is here in the United States, and so they might actually be having multiple causes of respiratory disease currently that are kind of being lumped together and reported as swine influenza cases, when actually, if they are looked at more closely and other diagnostic tests applied, you might be getting respiratory disease from a variety of causes.
Before this gets out of hand, can you assure people that they're not going to get this from eating a regular pork product?
Absolutely, and I can see where the confusion is since it's a swine influenza virus. This did originate in an animal at some point, but the transmission that we're seeing now is definitely person-to-person spread. People are not getting sick from being around hogs or by eating pork. It's certainly safe to eat pork, and there has never been an identified isolation of this virus in swine or hogs in the United States, so there would be no need to restrict movement or export of our animals.